Xeroderma pigmentosum. Summary. Xeroderma pigmentosum is a rare hereditary disease caused by defective DNA nucleotide excision repair mechanisms. Individuals with xeroderma pigmentosum are at high risk for skin and eye damage from ultraviolet radiation exposure, for example sunburn, pre-malignant and malignant skin lesions, dry eyes and keratitis. Some individuals with xeroderma pigmentosum also experience neurodegenerative disease that affects hearing, gait, and cognition. Genetic testing can confirm the diagnosis. Management is focused on the prevention of ultraviolet-related skin and eye damage with strict photoprotective measures, frequent screening for complications, and treatment of cutaneous, ocular, and neurological manifestations as indicated. Xeroderma pigmentosum, hyperpigmented, freckle-like lentigines cover the entire face and neck. The skin of the nose is atrophic and hypopigmented. These features are typical of Xeroderma pigmentosum. Etiology: autosomal recessive inheritance. Genetic mutations cause defects in DNA nucleotide excision repair mechanisms. Epidemiology: rare hereditary disease. Incidence is equal among males and females. Clinical features: cutaneous manifestations, slow healing, blistering burns after minimal exposure to sunlight in 60% of affected individuals, solar lentigines, xerosis and poikiloderma due to repeated exposure to sunlight, pre-malignant lesions, for example actinic keratosis, and malignant lesions often develop during early childhood. In patients with xeroderma pigmentosum, minimal ultraviolet radiation often causes severe skin damage and increases the risk of skin cancer. Neurological manifestations: progressive neurodegeneration affects 25% of patients, cognitive impairment, sensorineural hearing loss, ataxia, spasticity, decreased deep tendon reflexes. Ocular manifestations: photophobia and dry eyes, atrophy of eyelids, loss of eyelashes, keratitis, corneal opacification, loss of vision, malignancy. Diagnosis: refer to a specialist, for example dermatology, genetics for diagnosis. Confirmatory studies include genetic testing, cellular testing for defective DNA nucleotide repair from a pudge biopsy sample of minimally sun-exposed skin, for example upper inner arm or buttocks. A prenatal diagnosis of xeroderma pigmentosum can be made using amniocentesis or chorionic villus sampling. Management: treatment of xeroderma pigmentosum is focused on preventing damage from ultraviolet exposure and early identification and treatment of complications. Prevention of UV radiation damage. Advise strict photoprotective measures for skin and eyes. Perform skin cancer screening and ophthalmic examinations every 3 to 6 months. Pharmacological keratinocyte carcinoma prophylaxis may be considered, for example systemic retinoid, topical 5-fluorouracil or imiquimod. Individuals with xeroderma pigmentosum are at increased risk of vitamin D deficiency due to reduced exposure to UV light. Assess for and treat vitamin D deficiency as indicated. Management of specific disease manifestations. Management of xeroderma pigmentosum requires a multidisciplinary care team, for example dermatology, ophthalmology and neurology. Cutaneous disease. Treat pre-malignant skin lesions, for example actinic keratosis, aggressively to prevent progression. For malignant lesions, radiotherapy is usually avoided. Radiotherapy has traditionally been avoided in xeroderma pigmentosum because the disorder affects DNA repair mechanism and radiotherapy causes damage to DNA. Ocular disease: provide treatment for dry eye disease as needed. Refer to ophthalmology for UV protective contact lenses. Treatment of UV-induced eye damage and tumors. Neurological disease: refer affected patients to neurology. Regularly screen patients for hearing loss, refer as needed to for physical, occupational therapy, and speech therapy. Supportive care, offer genetic counseling to all patients, provide resources for the management of psychosocial issues related to social isolation, for example, support groups for patients with xeroderma pigmentosum, psychological counseling. Individuals with xeroderma pigmentosum are at increased risk for lung cancer and should be advised to abstain from tobacco use. Complications: skin cancer, basal cell carcinoma, squamous cell carcinoma, melanoma at a young age less than 20 years, malignant tumors of the eyes, eyelids, central nervous system, lung cancer. Prognosis: a life expectancy varies and can be significantly limited in patients with neurological disease, insufficient UV protection. Skin cancer is the most common cause of death in individuals with xeroderma pigmentosum. Thank you.